Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Rumination syndrome and malnutrition. When you hear of rumination syndrome, it's remote. It's something probably many of us have not heard before, but it concerns with regurgitation. Regurgitation is commonly known to us, but there are people who immediately after eating, within 10 to 15 minutes, they regurgitate what they have eaten, and that what they have eaten is more or less still in the form they took it in. It has not been digested. So some people may try to eat it back, or some may spit it out. This is very common in children, and some children, and especially in adults who probably indulge in the rushing food, or probably have that kind of experience somehow. The problem with it is that if care is not taken, there will be malnutrition. You can imagine vomiting as a problem of causing dehydration, apart from other things. The nutrients you want to take in with regurgitated food, or where you spit it out or whatever, it's going to be reduced. The body is not really absorbing, because if it's still at that perfect condition, it will quickly take it in and distribute it to all the cells, all the nutrients. But what is mostly affected, that one can use as a gauge, is where the nutrients, that is the malnutrition aspect. Malnutrition has to do with whether you are underweight, that is under feeding, or you are lacking in some vitamins and minerals, or where you are obese, overweight. So with regurgitation, rumination syndrome, you are probably looking at a situation where the person is underweight, and when you look at such a person, the person might not feel concerned, because the thing does not affect him at first, but internally there could be shortage of the required number of blood cells, or the hemoglobin concentration, and that is what we call anemia. Anemia should be suspected, and when the person is probably spitting out, or what he takes in is regurgitated again, then there should be supplements. Such a person should be advised to do certain tests in the lab, whether the blood volume test, or the hemoglobin estimation test, or iron ferritin test, in case of iron deficiencies. But there are other tests that one can do, and that is what I shall be exposing in the slide section. So let's move on into the slide section, but as usual, press the like button, subscribe for more detailed information. The outline: objective introduction, differentiation of rumination syndrome from acid reflux, laboratory diagnosis and recommendation. The objective: to create the awareness of rumination syndrome and its implication in malnutrition, which may necessitate the evaluation of some laboratory parameters. The introduction: rumination syndrome causes an automatic regurgitation of recently eaten food. Someone with this problem will often eat meals normally, but after about 10 to 15 minutes, undigested food comes back up into the mouth from the esophagus, food pipe, unlike the acid reflux that will not reach the mouth. It will be digesting, or probably even causing inflammation around the esophagus. This may continue for about 1 to 2 hours. The person may rechew and reswallow the food, or they may spit it out. Often this happens at every meal, day after day. Rumination is a reflex, not a conscious action. It is most often diagnosed in children, but it is also diagnosed in adults. Rumination syndrome is often confused with bulimia nervosa, gastroesophageal reflux disease, GERD, and gastroparesis, and I shall differentiate it from the reflux in the next two slides. Now, malnutrition refers to deficiencies, excesses or imbalances in a person's intake of energy and or nutrients. It could be undernutrition, which includes wasting, low weight for height, stunting, low height for age, and underweight. It is the presentation that you commonly see with people who suffer from rumination syndrome. The overweight people, obese, are also malnourished, resulting in SCDs. According to WHO, in 2022, 2.5 billion adults were overweight, including 890 million who were living with obesity, while 390 million were underweight. Globally, in 2022, 149 million children under 5 were estimated to be stunted, too short for age. That is probably underweight category. 45 million were estimated to be wasted, too thin for height, and 37 million were overweight or living with obesity. Nearly half of deaths among children under 5 years of age are linked to undernutrition, and that's where you might be suspecting the rumination syndrome, but it may not necessarily be that. It could be the hygiene of that area and the sanitation as well. These mostly occur in low and middle income countries. Yeah, rumination syndrome has to do more with underweight. Malnutrition causes severe systemic complications. When you're talking of people who really are underweight, including weakened immunity, becoming more susceptible to severe chronic infection, diarrhea, pneumonia, sepsis. These are what you notice more commonly in children that are underweight, and especially they are malnourished and becomes underweight. Due to impaired immunity, they suffer that, and muscle wasting and organ failure, leading to high risk of death, particularly in children. It affects every system, resulting in infection, heart failure, cognitive deficits, and impaired wound healing. So one needs to take malnutrition very seriously, especially in children. Now to differentiation between rumination syndrome and GERD, that is gastroesophageal reflux disease. Both involve regurgitation. So, but the acid reflux is a different thing, especially because it affects the stomach sphincters that prevents the food, the acid from flowing backwards. And when the acid really flow backward, that's the acid reflux that really damage the esophagus. Rumination involves the effortless, frequent, and usually non-sour, undigested food returning to the mouth shortly after eating, often managed with breathing exercise. Whereas GERD is a chronic, often painful, especially because of the acid condition, caused by stomach acid flowing back up, resulting in heartburns, nausea, and sour tasting regurgitation. While often misdiagnosed as respiratory GERD, rumination syndrome specifically involves the involuntary contraction of abdominal muscles to bring food up. It is important to note that a person can have both conditions, although they are distinct disorders of the gut-brain interactions. My area of competence is laboratory diagnosis. So the malnutrition, it depends on the complications of malnutrition when we want to really do the laboratory diagnosis. But the easiest and one of the most important tests are the hemoglobin concentration test, or PCB. Hemoglobin is a protein, and if somebody takes balanced diet, you are bound to have enough hemoglobin, except there are other conditions preventing it. And it's so easy that if the hemoglobin is estimated and is below the level that one can say is normal, the person is anemic, then you need to correct the anemia. is either by giving supplements. Most people will take blood tonic and vitamin B12, folic acid, depending on the conditions that the complete blood test, the full blood count, really presents. If it's microcytic or macrocytic anemia, there are other vitamins that needs to be taken. Minerals are also essential, so that will really help. The electrolyte level too, because when you are really regurgitating your electrolyte level, and the person may be prone to palpitations and other things that may arise. Finally, the recommendations. The gold standard investigation for rumination syndrome is high-resolution esophageal manometry. That is, you use the manometer with concurrent impedance monitoring, and that way they can confirm it. But to prevent the problem associated with that is that malnutrition that one will surely have from not feeding well. People with rumination syndromes are usually underweight and malnourished with a lower body mass index. So they are more likely to have a generally slender build rather than an obese one. So in effect, if their malnutrition is monitored, especially avoiding the anemic condition, they are sure bet instead of suffering other serious conditions, communicable disease, chronic diseases at old age. But our children, they need to overgrow it. So it's better to seek pediatrician's help if the child condition refuses to improve. There are more than enough videos for you to watch on this channel, all on health matters, improving our health, especially using the laboratory as a monitoring and evaluation instrument to make it possible. So the references are also there. Like I said, just click on the like button, subscribe, invite more subscriptions from your friends so that they can enjoy more and I can produce more quality videos.